Welcome, dear friends and doctors. Today's topic is COVID survivors and sleep problems. Does melatonin act as silver bullet? Guess who is with us? A person who is known for his kindness in Delhi, Dr. Manish Jain. Dr. Manish Jain is a healthcare practitioner who practices in the field of psychiatry in various prestigious institutions. He has more than 15 years of experience. He is basically graduated and post-graduated both from the prestigious Maulana Azad Medical College near Delhi. Presently, he is consultant psychiatrist at BLK Hospital. Doctor, welcome to the discussion. My first question.
Inviting me.
Thank you, sir. What is your initial comments on the topic?
COVID-19 was a great tragedy for all of us, and more so for the mental health, in the sense that we have seen that cases of anxiety and depression have increased manifold, because this is something which came out of the blue. We did not expect. We haven't had such an experience, and generally our mind works in such a way that there are certain things that we accept and we believe that can happen, but the way and the intensity and the abruptness of all of it was very which led to the psychiatric illnesses, more so anxiety and depression, rising manifold. And also the sleep, because every now and then I would get patients, but it would be more of known to us and friends, relatives who would be calling for sleep-related issues to me.
So, since our audience are more physicians, family physicians, general physicians, consultant physicians, why is it important to notice sleep problems in COVID-19 survivors?
See, in general, Deepak, if you'll see, sleep is something which has a restorative effect on the body. So there are studies which talk about impaired cognition, which talk about impaired immunity, which talk about mood symptoms, which talk about anxiety symptoms. And all in all, you will find that anxiety, sleep, and depression and immunity are interlinked. So if you're talking about people who post-COVID or pre-COVID also were having sleep disturbances, you'll find that they're more prone to have lower immunity. They are more prone to have cognitive problems. They're more prone to become anxious and depressed. And if you talk about people who are anxious and depressed and having sleep problems, so they are more prone to have impaired immunity. So all in all, it has a negative cascading effect on immunity per se. And sleep is something which was greatly hampered because, for many people, waking up in the morning is like a therapy. It's like a therapy in what sense? Like you have a strict schedule of waking up in the morning at 7 o'clock, 8 o'clock, so that you get to work, you get ready. There are things which are to be done, and it has a normalizing effect on sleep to some extent. But what happened with COVID was that this early morning schedule got disrupted, and because of which the sleep became erratic. And humans, like if you talk about in general, so our eating habits, our sleeping habits need to be on certain schedule so that the body follows that particular clock and things fall in place automatically. So because of the COVID, because of the impaired early morning awakening or impaired schedule in the morning, so there was no pressure to sleep at a particular time. And what people ended up having was sleep disturbance because there was nothing to look forward to in the morning. So getting up at a particular time, and the other liberty that they took was sleeping the daytime if they were not able to sleep adequately at night.
Rightly said, sir. Sir, the problems, the sleeping problems, is it uniform across all age groups like children, adolescents, adults, and elders in COVID-19, after COVID-19?
I am not aware of any study which talks about this, but in general, you will see that, or the profile of patients which kept coming to me. So I would find mostly people of middle-aged and above to be having more problems with sleep. Children or adolescent maybe were unique in that way, that maybe because their melatonin levels are normal, so they had the liberty of sleeping at 4 o'clock and waking up at 12 and still were able to maintain their health or body as such. But when it came to middle-aged people and older people, it had a very negative effect.
So you mean to say quality of sleep is also very important?
Yeah, maybe the quality, maybe the melatonin level, which keeps changing with increasing age, that our reserves go down, our level goes down. So maybe that was the reason, that maybe the older population, but exactly I'm not aware of any study which talked about this distribution in the age group of people
especially
having
in
sleep.
COVID-19. Doctor, especially, we have a tendency of being careless. So just like pain, sleep is also sometimes ignored. So do you think, since sleep problems are very common in elderly, do you think that they should consult their physicians or psychiatrists? Is it overdiagnosed or underdiagnosed?
See, generally it is underdiagnosed because sleep is something which is taken for granted. And for people who are not working, elderly especially, so people do not excessively delve into details of having a healthy sleep or healthy schedule, because always at the back of the mind that they can fulfill their needs in the daytime, they can lie down in the daytime, and because there's no pressure to wake up in the morning or perform in the morning, so that tends to be ignored. But sleep is something, as I told earlier, that it has a restorative effect. There are studies which tell that our connective tissue gets repaired in night, our mind gets repaired at night, our memory consolidates at night. So all in all, we are talking about a good night's sleep for living a healthy life. So it could be related to diabetes, it could be related to hypertension, it could be related to anything. So you talk about any illness and you will find that sleep has a restorative effect, sleep has a normalizing effect. I come across many patients who have uncontrolled hypertension, uncontrolled diabetes, because they are under stress, because they are not sleeping properly. So all in all, sleep is something which should be emphasized upon, which should be taken as part of history, which should be cross-checked with every patient, so that the other illnesses are kept in check.
Truly said, sir. So, thanks for making aware our audience that sleep is as important as sleep problems are as important as diabetes and hypertension. Doctor, though our audience is aware of melatonin, would you define it in your words?
See, simplistically, it is a sleep-inducing hormone which our body synthesizes, and its synthesis is generally good in the first half of our life, so maybe by 30, 40, and after that the levels which the body synthesizes keeps decreasing. So it is a hormone which increases when we are about 40, and generally it has been positively linked to sleep disturbance, that the hike or the increase that was supposed to be there, if it is not there, then going to sleep becomes a problem.
Do benzodiazepines contribute to respiratory problems in COVID-19?
See, they can, because they can have respiratory depression as a side effect because of the impact they have on the brain. Generally, at lower doses, this is not prominent. And if you're talking about people who have underlying asthma or COPD, it becomes problematic.
So post-COVID, is it like possible or proven that it can contribute to the, or it should be avoided, or it should be used specifically in the problems, post-COVID problems, who has respiratory problems?
It should be avoided because it can have a negative effect.
Why telemedicine guidelines have prohibited benzodiazepines and blood drugs?
See, these are drugs which have an abuse potential. So generally speaking, what happens is that once you write a particular medicine to a patient, the pharmacist generally helps the patient in terms of getting the prescription refilled even after the prescription is expired. And there would be a population or a subset of population which keeps using or abusing this particular medicine and hence will become dependent. So in keeping in view the dependence or the abuse potential, so they're generally to be avoided or kept in a constant vigilance.
Are these drugs controlled drugs? Benzodiazepines and that drugs? It should be given in a controlled manner.
There are many pharmacists who would not issue the drugs without a particular prescription or without the prescription of a psychiatrist. So I'm talking about the good pharmacies, but there are chemists which will generally help the patients in getting drugs without any prescription also. So they are controlled.
What is the optimal dose of melatonin, sir, in humans? Is it tolerable in long term?
See, there are no long-term studies as such, but the medium-term studies which are there, they generally endorse that it is safe. And since it's an old molecule, it has been there in the market since a long time, and there are no reported side effects in terms of organ damage, kidney damage, or liver damage. And because of this safety profile, it is an OTC product in many countries. So in many countries where you do not get 𝗖𝗓 or other benzodiazepine, you'll be able to get melatonin as an OTC brand because of the safety. 10 to 12 mg is a usual effective dose, is an effective dose of melatonin.
Good. Doctor, using 10 to 12 milligram, is it effective for the patient?
It is an effective dose. It can be used even higher also. It can be given 20 or 30 mg. So at 20 or 30 mg, the anti-inflammatory property and the sleep-inducing property, of course, increase. So depending upon the response of the patient, it can be used in.
So any abuse potential at using at this dosage?
No.
No. So it's not a controlled drug?
It is not a controlled.
It's not. Doctor, what is your final message to your fellow doctors in your closing statement?
See, we have to be aware of sleep like we are aware of any physical condition as hypertension and diabetes, because sleep, as I told earlier, can have a cascading effect on the physical condition. So, and sleep is something which is probably the harbinger of greater psychiatric disorders like anxiety and depression. So once it is taken care of, we can prevent the patient from going into severe conditions. That's it.
So you have quickly given all the answers of the questions, and we thank you for coming to this discussion platform. Thank you very much, sir.
Thank you, Deepak. Thank you for providing me the.
Thank you.